Number 41. During the preschool years, through what means do children learn sexual roles? The answer is, preschoolers begin to learn sexual roles through fantasies and playing games, watching television, and observing adults. Number 42. A 5-year-old child talks about his friend Charlie, who is big, green and plays with him. What does this behavior indicate? The answer is, magical thinking is a normal intellectual development. Number 43. A client functions at a mental age of 5 to 6 years old and is very competitive. What skills relative to this age might the psychiatric technician assist the client to develop? The answer is, learning to take turns and accepting losses graciously. Number 44. What should parents do to help school-age children learn responsibility? The answer is, what parents should do to help school-age children learn responsibility is, assign simple assignments, cleaning room, setting and clearing table, dishwashing, walking dogs, take out trash, rake leaves, water plants. Number 45. For what age group is it important to belong to a group or gang? The answer is, the age group is it important to belong to a group or gang is, the school age 6-10 years. Number 46. According to Erikson, what is the major challenge of adolescence? The answer is, the major challenge of adolescence is, achievement of identity. Number 47. What is the term used to describe the onset of menstruation? The answer is the term used to describe the onset of menstruation is menarche. Number 48. What is a common occurrence during the period of adolescence? The answer is, a common occurrence during the period of adolescence is, increase in independence and responsibilities, rebelling against authority, withdrawing or being critical of family, being moody, puberty. Number 49. Which group is most important to the adolescent? The answer is, the group that is most important to the adolescent is the peer group. Number 50. What is a prime concern for a teenager? The answer is, a prime concern for a teenager is, need for increased nutrition and energy. Number 51. What are some facts that would be correct for the nurse to give to the adolescent? The answer is, need for increased nutrition and energy. Some facts that would be correct for the nurse to give to the adolescent is, secondary sex characteristics begin to develop. For males, testicles and penis enlarge, facial and pubic hair appear. The voice deepens, most reach their height by 16. For females can begin as early as 9. Breast development, pubic hair, menstruation typically begins by 13. Number 52. A mother has brought her son, aged 12 years, to the hospital. She states that he has informed her that he has a crush on his best friend. The mother wants to demonstrate understanding and asks for help. What explanation is best to give? The answer is, she's in early adolescent stage. This stage is known as the awkward stage. She goes back and forth between childish and mature ways of appearing, thinking and behaving. Number 53. Which of the following factors will have the most influence on how young girls react to menstruation? The answer is, the factors that will have the most influence on how young girls react to menstruation is, the factor that will most influence the attitude about menstruations is the attitude of the mother. Number 54. During late adolescence, which behaviors would be cause for concern? The answer is, during late adolescence, the behavior that would be cause for concern is, achievement of identity. Number 55. According to Havyhurst, what is the developmental task of adolescence that should be mastered? The answer is, the developmental task of adolescence that should be mastered is, achieving sense of identity and developing a clear understanding of oneself and future goals. Number 56. A client at Canyon Springs changes girlfriends every couple of weeks. According to Erikson, what are the virtues of adolescence that have not been accomplished? The answer is, the virtues of adolescence that have not been accomplished are, fidelity and devotion. Number 57. During adolescence, what is a common source of caloric intake? An adolescent female client at Canyon Springs often refuses to eat regular meals or eats a minimal amount of food at meals. What is the term used for such behavior? The answer is, during adolescence, what a common source of caloric intake is, empty calories. The term used for such behavior of not eating is, anorexia. Number 59. Adolescents are at risk for drinking, drug use, and sexual permissiveness because of which factors? The answer is, adolescents are at risk for drinking, drug use, and sexual permissiveness because of peer pressure and low self-esteem. Number 60. An adolescent client at Canyon Springs expresses concern that legislation is too slow in creating alternative living arrangements for individuals with developmental disabilities. The psychiatric technician recognizes that this client is at which stage of cognitive development according to Piaget? The answer is, the psychiatric technician recognizes that this client is at the 12 to 15 years old stage. Stage 4 of cognitive development, formal. Number 6.